There's several types of brow lift procedures, and brow lift surgery has undergone quite a transformation even since I've been in practice in the last 15 years. Typically, patients with descent of the brow need a noticeable, measurable improvement in the brow position, particularly in the lateral brows. And for in my practice, to my mind, the most powerful brow lift is a coronal brow lift or an open brow lift, where one makes a cut across the top of the scalp, either in the hairline or behind the hairline, depending on the height of their forehead, lifts all the skin off the bone, re-elevates that skin and suspends the brows in a more elevated position. This has the benefit of removing the redundant skin, eliminating forehead wrinkles, as well as very powerfully repositioning the brows. It is, however, a very invasive procedure, and trying to convince patients that this is in their best interest can be difficult. However, in patients who have very significant brow ptosis, it, in my opinion, remains the best way to rejuvenate the forehead. Endoscopic brow lift techniques, whilst they do produce very little scarring and are far less invasive, also in my practice produce a much less significant elevation of the brows, particularly in the long term. There's no excision of skin, there's simply repositioning of the eyebrows and reliance on the adherence between the skin and the bone to hold that position despite gravity and muscle activity. So the failure of the endoscopic technique, combined with the invasiveness or perceived invasiveness of the coronal brow lift, has led to the popularity of a direct brow lift in recent years.